By now, you and the kids have been wearing a face mask for weeks, but how do you wear them? And do your kids know how to remove them safely? And what's the difference between the different types of protection? Well, to get answer to those important questions and other questions, of course, we are joined by Dr. Justin Skrinsky, who is with our sponsor, Beaumont Health. Doctor, thank you so much for being with us.
It's my pleasure.
All right, so let's get to the first question, which is a big one for me. What types of masks are effective?
Right. So the types of masks that you see people walking around with, we've got a couple. You see people with these sort of medical looking masks. And then also you see people with just kind of the regular cloth masks as well. So both of those are effective. The cloth masks that we see that are most effective are usually the ones that have a couple layers of material associated with them. And those are the ones that seem to have about the same benefit as the surgical masks.
Oh, wow. Okay. So, how do we need to wash our hands before handling the masks? Like, I would have never thought of that.
Right. So obviously, you don't want to contaminate the mask putting it on. You also don't want to contaminate your hands when you take the mask off. So what you want to
Mhm.
do is wash your hands pretty thoroughly, soap and water. You can also use any sort of alcohol-based cleaner, and that's what the first step you should do before putting the mask on.
All right. I know that sounds simple, but that's like a mind-blowing revelation to me. That's great information. So, what is the recommended way to remove a mask then? Or rather, to what's the
Right.
recommended way to wear a mask? Let's start with that. I'm getting ahead of myself.
Right. So obviously, you want to wear the mask when you're coming in contact with other people. Social distancing still very important. The way I put it, none of these are cures. These are all just simply tools to help prevent the spread. So when you're putting a mask on, it's pretty simple. You want to hold it by the loops here. Try not to touch the front of the mask, and then you pretty much just put the mask on and slip it over your ears like this. When you're taking the mask off, it's the same thing. You want to reach behind, use only the loops, and try not to, again, touch
Mhm.
the front of the mask either. So pretty much you're just always handling the mask just by the loops here. And that way, that keeps your hands away from the front of the mask where there might be contamination. And then you want to follow that up again, like we talked about with more hand hygiene. So hand washing or another alcohol-based cleaner.
Okay, so now let's talk about this. How does the way we wear the mask impact the transmission of COVID-19?
Right. So that's kind of a running joke that you see a lot of the times now. You see people with the
Mhm.
mask either under their nose or on their
Right.
chin. Obviously, these things are not effective because the masks really what they're doing is they're helping to prevent transmission. They give you a bit of protection as the wearer in terms of not getting the virus, but the main way they work is by preventing the spread. So really, what you're trying
Mhm.
to do is you're trying to block any sort of droplets or particles that are coming from your mouth and nose when you breathe, cough, sneeze, even talk.
Okay, so now here's something that gets kind of awkward for me. Sometimes the mask is slipping around on my face. Can I touch it to adjust it? Is that okay?
Yeah, so it's okay. Obviously, if you're out and about, you have to make those adjustments from time to time. The best way to do it is if you do adjust the mask, if you have some sort of hand sanitizers to quickly do that afterwards, that would be the best way to go about it.
Okay, so now here's another question, also big for me. Can you tell I'm into this topic? How do you suggest we store our mask?
Right. So if you look at the recommendations, they say wash your mask after every use. And obviously, for a lot of people, that's not going to be practical. If you have more than one mask, you can obviously rotate them. But again, it gets into kind of a tricky situation. So in terms of storing the mask, if you can store it on something disposable, a piece of tissue, something like that, that can then be thrown away after you put the mask back on, that's one way to do it. It's kind of a ubiquitous thing now. You see the mask hanging from the rear view of the car. Not the best way to do it, but at the same time, you're avoiding touching that surface of the mask to another surface where you might contaminate. So, hanging the mask is certainly fine. Again, you just want to make sure that no one else is going to come into contact with that, and it's not going to bang around and touch any of the other surfaces around it.
Oh, great information, Doctor. Thank you so much for joining us.
It's my pleasure. Anytime.
All right, and we are going to continue this conversation. Join us on the Live in the D Facebook page at 1 p.m. this afternoon. We will be answering the most frequently asked questions when it comes to your face mask and the safety of you and your family and our community. I'm looking forward to this. And to learn even more, visit Beaumont Health's website at beaumont.org/masks. And of course, we hope that you join us at 1 p.m. for more great information.